This is NBC10 News, live at 5.
News that's shocking the entertainment community. The mother of Grammy Award-winning artist Kanye West dies after complications from surgery. I'm NBC10's Kristen Welker. Ahead on Live at 5, we talk with an expert about what you need to know before you go under the knife.
An autopsy expected tomorrow on the mother of rap star Kanye West. She died suddenly over the weekend in Los Angeles. The coroner's office says a recent surgical procedure might be what killed her. Access Hollywood and other media sources say it likely happened after plastic surgery. We all know that a little nip and tuck has become so common and popular these days, but Donda West's death reminds us all it's still surgery, and there are always risks. Still, it has a lot of people asking, how could this happen to someone who has enough money to hire the best? NBC10's Kristen Welker joins us live in the News Center with more. Kristen?
Well, Vince, Donda West was just 58 years old, and as Kanye West's manager, she could afford to have the best doctor in the world. So many are asking, how could she have possibly died from something that's become so common as plastic surgery? Well, she might have had a pre-existing medical condition. We don't know that yet. But more importantly, at least one local surgeon says it is clear she may have been trying to have too much done all at one time. She was his mother, the inspiration for her song, a former college English professor who gave up her career in academics to manage her famous son's hip-hop career. But over the weekend, Donda West lost her life, reportedly after a tummy tuck and breast reduction surgery.
But this is way too much surgery to be done together at one time.
Dr. Kirk Brandow is a board-certified plastic surgeon. He says any qualified surgeon knows the longer you stay on the operating table under anesthesia, the longer your risk for complications. He says even if you're healthy, doing two major procedures at the same time is extremely dangerous.
They do tummy tuck and breast reduction at the same time, both of which are 3 to 4 hour procedures. This significantly increased the patient's risk, and she probably had a pulmonary embolism. You have a little pouch in your stomach that you want me to help you take care of.
Yes. 42-year-old Andrea Hammond is also considering a tummy tuck.
Everything you do has a risk. You can walk out your door and your life can be taken.
But you can cut down on your risk by first making sure your doctor is a board-certified plastic surgeon. Donda West's surgeon was famous celebrity doctor Jan Adams, seen here in a mugshot from a DUI arrest last year. He's appeared on scores of TV shows and even hosts the Discovery Channel's Plastic Surgery Before and After. The American Board of Plastic Surgery confirms Dr. Adams was not board certified. In fact, Dr. Brandow says in the U.S. it is not required by law to be board certified to do plastic surgery.
There are ophthalmologists who are doing tummy tucks.
Dr. Brandow says a patient needs to know about their doctor's training. You cannot trust an ad in the newspaper or radio.
Find out who your surgeon is. Ask around. Look on the internet. Make sure that you talk to previous patients of his. And go by word of mouth. Word of mouth is the best way.
Really good advice. Now, you're definitely not a good candidate for plastic surgery if you have a heart condition, if you have problems with healing, a bleeding disorder, difficulty with breathing, or a history of pulmonary embolism, and even obesity. Such a sad story, Vince.
Yeah, indeed it is. You know, I have another question I'm curious about. What are some other red flags when you're trying to shop for a doctor?
Yeah, it's a good question, Vince. You want to make sure that the doctor doesn't recommend a prolonged procedure. That is one major red flag. Look at the number of body parts involved. Dr. Brandow says your body can only take so much trauma at one time. If a doctor does agree to do more than one major procedure at the same time, you should probably look for another doctor and definitely a second opinion.
Yeah, second opinion, very important. Thank you, Kristen.
Thanks.